Pediatric cancer is a fight nobody should face alone.
When a child is diagnosed, the entire family is affected in that diagnosis. And so the Austin Hatcher Foundation truly bridges the gap of services for the entire family unit. So we provide behavioral, mental health, social, psychosocial support, but not only for the child with cancer, siblings, parents, grandparents, because we want to make sure that the family unit is taken care of during this entire journey.
Some of the families could be looking for counseling, they could be looking for marriage counseling, grief counseling, or they could be looking for opportunities for their children to socialize with kids who are having experiences like them that are very unique to their family.
Jesus was 10 years old when he was diagnosed. Just to see your kid in the intensive care unit, connected to the dialysis machine, you feel like you are losing everything. Just watching him, enjoying here, having fun. It doesn't matter if it's at the body shop or if it's on one of the multiple camps that he attends. It puts my soul back to my body.
Play is the work of kids. So a lot of times we're able to understand how a kid is processing emotions or how they're interacting with other people in a play-based setting because it is a time that their guard is down. So we are trained professionals in looking for if there's a behavior change, if there are deficits that we need to address. And we are also able to talk to the kids in private through our therapy services and then again watch them as they grow and their goals that they're working on with our clinicians.
When a child goes through, like anyone going through the journey of cancer, there is no timeline. It is something that there is stages of remission. There are times when they get to ring the bell, but that doesn't mean that there aren't any other emotional or social, academic things that the family might see that we are going to be here for them however long they want to come in.
The Austin Hatcher Foundation provides a lifeline of hope for families wherever they are in their pediatric cancer journey. As a mother who has walked this path of having a child with leukemia, it's extremely reassuring to know that there's a foundation that provides meaningful, impactful services for every member of the immediate family and a community of families to connect with, to learn from, and build relationships.
Getting connected with the moms that I have met through Austin Hatcher has been so huge for me because I have had those moms that are further along in the journey. I know that you will be able to get through this. You just have to take it one day at a time. You have to put one foot in front of the other.
The Austin Hatcher Foundation has been a safe haven for us this year. I could come and have a little safe space where I could talk and let things out. I knew that my husband could do the same. And I knew that each of my children were just, being taken care of by somebody that was there for them, that they could open up to, which they did.
The Austin Hatcher Foundation provides comprehensive coordinated care in a holistic approach through a lot of different services. So behavioral health, mental health, one-on-one counseling. It can be group counseling. It can be occupational therapy, neuropsychological testing, academic coach, anything and everything that you would think of ancillary services outside of medical treatment we provide here with licensed clinicians.
We offer a variety of family programs, anything from community-based programs that we partner with local community members with, such as Road Atlanta, or our sports partners like Lacrosse Out Cancer with Lee University or Chattanooga Football Club, where we host soccer games. Those provide opportunities for families to have normative experiences with people that have gone through similar experiences with them. But we also provide programs such as teen nights and young adult nights, where we're able to address unique needs of teens and young adults impacted by pediatric cancer.
We have an educational advocacy program to help school children who are impacted by pediatric cancer. Alongside parents and licensed professionals, we develop an individualized plan. We create and schedule tutoring sessions and skill development, as well as collaborate with school staff to support each child's unique needs. Our staff psychologist performs neurocognitive or neuropsychological testing, which essentially evaluates your brain function. It tests for a variety of mental functions like learning, reading, attention, memory, problem solving, language, as well as mood and behavior. It is instrumental in monitoring changes, but also in developing interventions that support the patient's strengths and weaknesses.
The Austin Hatcher Foundation's Education Advancement Center is a 33,000 square foot facility here in Chattanooga, but we are growing our online resources. No matter where a family lives, there are things that can walk them through wherever they are in their journey. If it could be something where they're getting back into the school, if it's something as complex as grief, or even coping with the loss of their hair, we are growing our online resources to follow these families and be a support system no matter where they live. All services provided here at the Austin Hatcher Foundation are at no cost. We do not bill insurance. It is not something that we take a copay. Anyone and everyone that comes through our doors, it is absolutely free. And that is because of our donors, our supporters in our community and across the nation to be able to provide these services.
I would describe the foundation as a lifeline for families that are going through pediatric cancer, because your world is turned upside down and there's so many days where you feel like you're drowning, and you can just come here and kind of get your head on straight and know that it's going to be okay, because you've seen people that have already gone down that path before you, so it doesn't feel quite so lonely.
The Austin Hatcher Foundation wants to treat these families not only in a time frame of when they're diagnosed or within certain times of routine maintenance, but really for their lifetime. You never know late effects coming for the child with pediatric cancer, or if the siblings might have a hard time 5 years down the road with something that they're dealing with. We're here to support them no matter how far away or how far they are in their journey. We want to be here every step of their way so that they never feel like they're alone. It's building a community within the oncology world, again, for their lifetime, for every individual.